Last week, we started our discussion on abortion. We focused on one type of abortion, that is spontaneous abortion or miscarriage. This week, we are going to look at the other type of abortion, that is induced abortion. We'll be talking to a specialist who will throw more light on induced abortion. This show is proudly sponsored by Moose Condoms and Home Fresh. Stay with us, we'll be right back.
The World Health Organization defines unsafe abortion as a procedure for terminating unintended pregnancy carried out either by persons lacking the necessary skills or in an environment that does not conform to minimal medical standards, or both. According to them, 25% of all pregnancies end in a self-induced abortion, and the rate of abortions are higher in developing countries than in the developed regions. Women all over the world are likely to resort to an unsafe abortion when faced with an unplanned pregnancy, and provisions for safe abortions are restricted, unavailable, and inaccessible. In Ghana, despite the availability of safe, legally permissible abortion services, high rate of mortality and morbidity from unsafe abortion persists. Any woman with an unwanted pregnancy who cannot access safe abortion is at risk of unsafe abortion, especially women living in low-income countries and poor women. Deaths and injuries are higher when unsafe abortions are performed later in pregnancy. Following unsafe abortions, women may experience a range of harms that affect their quality of life and well-being, with some experiencing life-threatening complications. According to research, the rate of unsafe abortions is higher where access to effective contraception and safe abortion services are limited or unavailable. In a developing country like Ghana, the rate of unsafe abortions is likely to continue to increase unless women's access to safe abortion and contraception and support to empower women, including their freedom to decide whether and when to have a child, are put in place and further strengthened.
Do you think abortion is legal? Well, let's leave this question to Doctor. I have with me Dr. Benedict Afari. He's here to educate us more on induced abortion. Doctor, you are welcome.
Thank you very much.
All right, great. Doctor, what is abortion? In fact, induced abortion.
Okay, so induced abortion simply means the termination usually of an unwanted pregnancy. So with this one, there's an intervention. It's not occurring on its own. So once there's somebody intervening, then it's called an induced abortion.
Right. And what are the types of induced abortion?
So with induced abortion, depending on what happens, it could either be a safe abortion or an unsafe abortion. So those are the two categories. Safe in the sense that it's being done by the health worker who is trained to do the procedure, and it's also done with the right equipment and also in the right place, that is either a hospital or a clinic. So what it means that when you do an abortion process outside these that I've mentioned already, then it is declared as an unsafe abortion.
And what is the rate of unsafe abortion in the country?
About 15 to 20% of the abortions that happen in the country are all unsafe abortions. I mean, if you look at the statistics worldwide, they said about 42 million abortion cases happened every year, and about 20 million of them are all unsafe abortions.
Okay, and are there any complications related to unsafe abortion?
Yes, definitely. And even if you look, the reason why we are health experts are quite concerned about unsafe abortion is the fact that it's actually one of the causes of maternal mortality. Okay. If you look at the top 10 or even the top 5 causes of maternal mortality, okay, unsafe abortion is one of them. Yeah.
So apart from the maternal mortality, what other complications can result after unsafe abortion?
Yes, so unsafe abortion can actually lead to infections. So most people, Once you don't do it the right way, you end up getting post-abortal complication. You can get pelvic inflammatory infection.
Okay.
Then you can actually bleed from the unsafe abortion. Then even in future terms, you could also have the infection that you have could actually result in infertility. That is tubal blockage.
Okay.
Yes.
Wow. Yeah. Okay. The complication you mentioned is quite dangerous. So how can we reduce the rate of abortion in the country?
Okay, so in order for us to reduce the rate of unsafe abortion, that means we need to give those who need it safe abortion. That's what it means. So in the performance of the process of abortion, we need to provide the right means in terms of the equipment, in terms of the logistics, in terms of the personnel, and even the location or the place.
Okay.
Yes.
But is abortion legal?
So abortion is largely not legal in Ghana, but there are certain circumstances or situations that abortion is permitted according to the abortion law of Ghana.
And what are those situations?
Yes, so situations such as if you have a defilement, you have a rape,
okay,
or you have an incest.
okay,
So if any pregnancy arising from either defilement, rape, or an incest, according to the law, it can be permitted for it to be terminated. Then when you have a pregnancy that is posing either physical or mental stress or disability to the woman, the law permits that that pregnancy can be terminated. Then the third aspect is that if you have a pregnancy that it's continuous, if the pregnancy continues to stay, it could pose a challenge to the mother in terms of her medical condition, then that's also the law permits that it can be terminated. Then the last reason that you can actually allow abortion to go on is when the baby that is going to come out from the pregnancy, the baby might have a deformity or disability that is not compatible with life. So if you have this kind of situation, the law permits that that pregnancy can be terminated.
But can I walk into any health facility and opt for abortion?
So if you want to go strictly according to the Ghana law or the abortion law, it is not.
Okay.
But in some countries, abortions are permitted on request by the individual or by the woman.
And how do you go about those permitted by law?
Okay, so for those abortions permitted by law or the situations permitted by law, there are two main ways of terminating those pregnancies. So we have the medical means and the surgical means.
Okay.
So for the medical means, we have some medications that the health personnel will prescribe for the patient.
Okay.
Then with the medication, we have various ways of administering the medication. So sometimes we can give it by oral means, that is just like you're taking any other medication. At other times too, we may ask you to put it under the tongue. That is what we call the sublingual route. Then there are times that we will actually have to put the medication in the private part of the woman. So there are three main ways of administering the medications that we use to terminate pregnancy. Yes. Then with the surgical means, we have some instruments that we use. In the past, we were doing what they call the D&C. So that one, basically, we have some metallic instruments that were used to be able to evacuate the uterus or the womb. But now we've recommended that they use what we call the manual vacuum aspirator. That one is like a plastic syringe that through vacuum pressure we use to terminate the pregnancy. Some other people use electric suction to do that. Okay. But basically now we encourage people to use the manual vacuum aspirator. We call it MVA for short. Okay. The MVA kit. So that's what we use. But we are going to explain the process into detail later.
You mentioned that the only way we can reduce abortion is to provide safe abortion to those who need it. So how do you go about that one?
Okay, so for us to be able to reduce the incidences of unsafe abortion, we have this concept we call the comprehensive abortion care.
Okay.
So with the comprehensive abortion care, what we do is that we are trying to manage those who have actually gone to commit unsafe abortion. So all the complications that are arising from unsafe abortion, we treat them. Then those who are coming for the abortion that is permitted by law, they go through a certain process.
Okay.
So we need to counsel them. We need to offer family planning or contraception. Then we need to do the process in a safe way. Then after that, when they have any post-abortal complication or what we call the post-abortal care, we give to them. So by this, we're able to reduce the incidences of unsafe abortion in the population.
Doctor, we would like to see how the surgical abortion is done. But before that, let's take a breather. When we come back, we'll continue our discussion on abortion.
What I think can result from unsafe abortion, sometimes the person who goes in for the abortion may end up dying. And also, if it's not properly licensed institution, maybe the one who is going to conduct it may either damage your womb or something.
Probably death, because unsafe abortion is when they don't go to the hospital. So if you are doing it at home there, you probably bleed and die.
Safe abortion, the person might die out of it. That's if the person tries to abort by himself, him or herself. Okay, let's say herself, because it's always the lady side, so herself. So always, even before you abort, and we have types of abortion. Okay, we have the one that the person does it willingly and the one that's unwillingly. That one results as from pregnancy. Sometimes during miscarriages and all that, you unwillingly abort the baby.
It will cause a lot of problems because it can cause womb damaging and then even death.
So what if you now when you now dear drew a shisha one and yeah, a bema will and I did back on says so a yammy chua say over fire for now and you're fine.
It can cause death, maybe it can also cause severe infection.
Probably you could lose your life and maybe some you could also have issues with maybe childbearing afterwards.
What can result from unsafe abortion is death. There will be many deaths which nobody can account for, and nobody will tell you why the death came, because they know it's illegal and it's unsafe, but they do it.
You go there, idea first, a friend said Bible, like I said here, and I saw that in so. Idea like say, who committees are the now? Say like, who you say go? You will never be a bit me about so. A moja bit more too. I'm our banner. It
has a lot of negative implications on the mother. You can lose your life, it can damage your womb, and then the child can be disabled. Maybe you, when you don't do it well, the child wouldn't be able to come out. Now you bear the child, and then the child will lose an arm, a leg, so you disable the child.
It should be to give an individual the chance to decide as to either they are going to keep it or they are going to the little research or the little I have heard of is that some does it when maybe they have finished giving birth. Though yeah, someone would say the Bible also says that okay, you should multiply. I mean, we look at that side, but when it's also a danger to the person's health, well, it's good to go in for that choice, just to abort for the person also to be safe.
Even the youth are having more sex than even the adults. So if it is legalized, it will give them the opportunity to have more sex and think of aborting it when they get pregnant, and they'll also not be encouraged to use protection and also take the contraceptive, and it will increase sexually transmitted infections too. So I think it shouldn't be legalized.
I'll say yes because when it's legalized, people wouldn't be taking in concussions and other stuff to abort the baby. But no, in the sense that when it's legalized, a lot of people will go in for it.
If they don't legalize it, the ladies or if unwanted pregnancy occurs, you go in for drugs that are not prescribed for you, and then it will end up that killing you or destroying your life.
Yes, please, it should be legalized. That way it will help to stop death, and it will help the one who cause abortion not to get further infection.
It shouldn't be legalized. I don't budge for that. No, I don't budge for it being legalized.
I will not recommend that it should be legalized. Should it be legalized, then it should be done properly. But if you legalize this and there is no monitoring, and people will know what they should do, right, to make them safe, then me, I will not recommend its legalization.
Because to me, idea is to me protection, like say a beer or bepe, a drubi, ne wako schools. Now what it's chama and kwalan because they say kwalan be blast on heading. Okay, say like children say like free, sad and any because I didn't dare the lamb back by a sea pet or can't be a bit me the bomb home mine, our moon conquer science.
I don't think abortion should be legalized because its implications on women is so huge and very bad, so it shouldn't ever be legalized.
I'm still here with Doctor, and he's going to demonstrate how surgical abortion is done. So let's pay attention to him. Doctor, why was DNC discouraged?
So DNC was discouraged because it was causing a lot of complications. So for example, it could cause a lot of bleeding. Then it could even cause perforation of the womb.
Okay.
Then one other complication was that it was causing, especially those who do a lot of the curetaging.
Which one is that?
Okay, so that is excessive scraping of the inside of the womb. Okay. So when it happens like that, the womb heals and it fixes together.
Okay.
Yeah, so these are some of the reasons why DNC has been discouraged, and now we prefer that we do the manual vacuum aspiration.
Okay.
So when you come to the hospital, before we even perform the procedure, we need to talk to the patient. We counsel the patient about what to expect and what not to expect. Then we'll examine the patient.
Okay.
After we finish the examination, that will help us to know how many weeks the pregnancy is, because you need to know so that it will guide you when you are doing the procedure.
Okay.
So we make sure that we ensure aseptic condition.
Okay.
Everything should be under aseptic condition. Then the woman is going to be positioned. After that, we'll clean the woman. Then we'll look at the instrument that we have. We need to set up even before. So this is the instrument we are going to use. This is what we call the manual vacuum aspiration kit.
Okay.
This is the MVA
Doctor,
kit.
Before you continue, I want to know whether you give any medication before the procedure.
Yes, I will come to that.
Okay.
But so this is the instrument,
Okay.
and that's what we call the speculum.
Right.
That's what we put to in order to give way for us to examine the vagina. Then these are what we call the cannula.
Okay.
So this is what the blood is going to pass through.
Okay. But I've seen different colors. So what are the differences?
Yes, so the different colors are different sizes.
Okay.
Sizes of, before we do the procedure, we need to make sure the mouth of the womb, the cervix, is open. Even if it is not open, we use the instrument to help it to open before we can get the contents of the womb.
Okay.
Yes, and back to your question, before we perform the procedure, we give a form of anesthesia. Most of the time, we give what we call the paracervical block. What that means is that we're going to put some medicine around the cervix, and that will numb the place so that the entry process will be less painful. Yeah, even when you go to certain hospitals or facilities, they actually give other medication just to sedate the patient so that she doesn't feel the pain. But most centers, after they've just done the paracervical block, it is okay. They want the patient to be awake, then the procedure can go on. Then after the procedure too, they can give a form of a painkiller that will bring down the pain.
Okay.
Yes. So, like I said before, we'll position the patient, we'll make sure our instruments are well prepared.
Okay.
Then we are going to, and we'll clean the patient. After we clean the patient, we're going to use the speculum. We put it inside the vagina of the woman. Okay. Then we'll stabilize it.
Okay.
Then there's another instrument that we use that will hold the cervix.
Okay.
After we've held the cervix, then we can take our cannula. We'll go in this way. Make sure it enters the womb before we use the kit.
Okay.
So the kit, we're going to fix it to the cannula. Then, so what we are doing is to create the vacuum. You know, it's called manual vacuum aspirator. So we need to create a vacuum. And once you create a vacuum, when you release it, the pressure will help to suck the content of the womb into this.
Okay.
So you do it a couple of times to be sure that the womb is empty. Then you can complete the process. But before you even know that the womb is empty, you need to make sure that there are no contents coming out.
Okay.
And when you get to that time, to realize that there's a grip on the cannula. Okay. There's a grip. Then sometimes you see some foamy liquid coming out. Okay. So these are the ways to tell whether you've completed the process or not. So after you finish the process, then you thank the woman, you remove all your instruments. Then if you need to give any form of a painkiller, you
okay.
give it. Then you can reinforce the counseling on the contraception that we talked about. You know, we are trying to do comprehensive abortion care because some of these pregnancies are unwanted.
Okay.
So you want to prevent a woman for getting pregnant again. So okay. you talk to them about the contraception. Sometimes some of the contraception you can actually give to them or offer to them just after the procedure.
Okay.
But most of the time they will come back on a review visit. Okay. Then whatever contraception that the woman has accepted to do, they will give to her.
Okay. If you look at the cannulas, they are long. So how will you know that the length that has entered the uterus or the womb is enough?
Yeah, so before you even start the process, you examine the woman. So you can tell the depth of the womb. Okay. We actually have an instrument we use.
Okay.
You put it inside. It will help you to know the length of the womb. So that when you are using the cannulas subsequently, you know how far you will go.
And do you give any medication aside from the painkiller?
Yes, we normally give them antibiotics after the process
What's
to prevent infection.
So doctor, how soon can someone start birth control after abortion?
The family planning methods or the birth control methods, some of them can actually be started right after the procedure. Okay. Especially like the one we put inside the womb okay. or the implant. We can start right away. But the tablets and the other hormonal ones, usually when they come for review before we give them, because we want to be sure she's fine, there's no content in the womb and everything is okay. Then we can offer them those other methods as well.
And are there any complications after EOU or this procedure?
Yes, so after the procedure, the patient can actually bleed, especially when the procedure was not completed. Wow. Then it could be an infection, or the patient could still be having pain immediately, or even sometimes they could have pain for about a week. Then if it's not done by the right person with the right instrument, then you know they could have some sequelae, future problems. They will have infection that can cause tuber blockage in the future.
Okay, and is there any need for follow-up visits after abortion or EOU?
Yes, usually after the procedure we ask them to come back for it. Sometimes we ask them to come in a week or 2.
Okay.
Then we will check on them and be sure they are fine.
All right. Doctor, thank you. We really appreciate your time with us.
Thank you.
Let's try as much as possible to avoid unsafe abortion. But if you need to do it, then go to a health facility. Thank you so much for watching HEALTHLINK TV show. Join me same time next time for another amazing episode. I wish you Merry Christmas and a Happy New Year.
Health tips. Complications of unsafe abortions. One common complication of unsafe abortion is failure to remove or expel all of the pregnancy tissue from the uterus. Unsafe abortion can lead to excess bleeding, that is, hemorrhage, and infection. Unsafe abortion can cause uterine perforation when the womb is pierced by a sharp object. It can also lead to damage of the genital tract and internal organs by inserting dangerous objects such as sticks, knitting needles, or broken glass into the vagina or anus.